I have the pleasure of announcing our closing remarks speaker, Trooper Sanders. He is the CEO of Benefits Data Trust and has over 20 years experience at the intersection of business, government, and nonprofits. My favorite fact about him is that he's on the national board of the Girl Scouts. Benefits Data Trust is an innovative nonprofit that uses data, technology, and direct service to close the gap between public benefits and those who qualify for public benefits but aren't currently enrolled. Let's give a warm welcome for Trooper.
Thank you really so much. This has been a really interesting day, the breadth of topics and people, and I was actually just saying that it will be interesting to look at the agenda for the first healthcare conference here to see the topics that are covered compared to today. And yes, I am on the National Board of Girl Scouts. I do actually have 2 t-shirts that say "Man Enough to Be a Girl Scout." So a little plug, it is cookie season. I'm sure many people have their favorite cookies, so you know what to do. I don't have to make a blatant commercial plug for Girl Scouts. So, you know, I think what's really been interesting for me is that the conversation about healthcare is no longer just about sickness and hospitals and what happens in the exam room, but it's really the broad range of things. You know, 20 years ago, I did a lot of work on mental health, and while some things haven't changed, such as the conversation about how do we make mental health parity real in reimbursement rates and addressing stigma, the fact that it is comfortably having a place at a conference like this shows that there is progress. And Benefits Data Trust, while we focus on public benefits, our reach is across the range of issues that has become known as social determinants of health. And so here's the problem that we are trying to solve. We've put a lot of blood, sweat, toil, tears, and taxpayer dollars into creating public benefit programs in the United States, like Medicare and Medicaid, food stamps, which is now known as SNAP, home energy assistance. And the reality is, for all that work that's gone into it and all of the political organizing and conversations that we have to protect those benefits and all the taxpayer money that goes into them, there are still millions of people who qualify for those programs who can't get them. And that's leaving people hungry, leaving people sick, and having people live in homes that are not comfortable. And the essential problem is, you know, there's a balance. We have a public program, we have to protect public dollars, and so there needs to be some process, if not friction, in the system to make sure that people who qualify for the programs actually get them and those who don't. But as you can imagine, with any complicated system, it has grown into this behemoth of an operation. And I would just say that if Harvard Business School ever needed to do a little extra cull of applicants to tighten up the pool of the classes here, you could add to your GMAT and your essays and your GPAs and all your professional experience, add making each applicant apply for food stamps or WIC or Medicaid by yourself and see if you get through that application process alone. And if you don't get in. And if you do, we could have this conference in a much smaller auditorium. So for us, you know, like healthcare, when everyone here is energized about healthcare, you really have to operate on a number of planes. You can't just think about big thoughts and what should healthcare be, what are the dreamy ideas. You have to both exist in what happens today and make the system work because there are real people who have conditions and needs that you have to satisfy. You have to think about tomorrow and the kind of horizon that's within view and think about how do we make this current system a little bit better, a little bit more efficient? Where are the cracks for innovation and opportunity? And then you have to have the big thoughts and the big action around systemic change and all the extraordinary things that we should be doing. And in many ways, that's how Benefits Data Trust works, where tomorrow morning at 8:55 a.m., I have a whole crew of amazing, energetic people who are on the phone talking to people all across the US who need healthcare, who need food assistance, who need a range of help in a number of states. And we've developed an expertise of how to work through all these complicated applications and how to talk to people, many of whom are facing other challenges in their life. They may have limited literacy or other sort of challenges. And how do you work with people in a respectful, dignified way and help them go through a fairly complicated process to get these benefits? But then we also work at the intermediate stage. And so there are opportunities for states to simplify some of the things that they can do. So for example, instead of the system now, where if you need food stamps and food assistance and Medicaid, there's a dual application process and all the rigmarole. And we work with states and work with them on policy advice to figure out how can you tap some waivers the federal government allows so that you can essentially take the data from food assistance and essentially waive people in to Medicaid. And then we're thinking about the big picture and what should our social safety net look like in the next 5 to 10 to 20 years on out. And thanks to some great support, and I apologize, I have to give them a little bit of a plug, but the Rockefeller Foundation, MasterCard, and the Ballmer Group, we're at the beginning stages of a 5-year data, technology, and policy initiative to really scale our work and really figure out, can we apply machine learning and artificial intelligence? Can we build software and other technology tools? And can we advance policy work that can fundamentally crack open this hairball of a challenge that's benefits access, that keeps people sick and keeps people hungry? And this part of our work, and it's really exciting, and we're hiring engineers and data scientists and all these other sorts of things, but it's really gotten me to think about, when we talk about applying technology to different spaces, it requires, on the one hand, some ambition and energy, which a lot of people have, but for folks who've been involved in this, you really need some humility, and you have to sort of check your ambitions against the reality of situations. And not only how hard and how much work it requires, but frankly, you have to be careful to make sure that the application of data and technology can't always do good, and in some cases, it may do harm. And that really got me thinking about our work and where data and technology is fitting across our society and the economy. And we could do everything possible to get everyone who is eligible for Medicaid enrolled, but if we don't have a health system that's accessible, that's both innovative but also has equity baked into it, so people who have been traditionally left behind are incorporated into these great innovations and advancements, our work won't go anywhere. We could do everything in the world to have everyone who's eligible for food stamps to be able to buy a bag of groceries, but if there's no grocery store and fresh food to get them, it doesn't mean anything. And then if we think about all the exciting things that are happening in retail, and some of your colleagues at the business school who are excited about retail, and we're thinking about cashless stores and little bots and things that'll fly or wheel your goods to you, all of those innovations that are really exciting and will probably, frankly, enhance the lives of those of us who are fortunate enough to be in these kind of rooms. What does it mean to the food desert? What does it mean to the senior citizen who can't get out to get food? And then if we think about one of the most important pieces of health and wellness for anybody is a job, and is a good job, and is economic opportunity. Well, now we're applying data and technology to the workplace in ways that in some ways increases productivity and can lead to other advances, but we're also seeing that there is a quote unquote surveillance in the workplace. And we're also seeing that if you're applying for a job, and I imagine in a certain number of points many of you are and you're thinking about it, but now we're applying machine learning and artificial intelligence to screening folks. Now that's based off of a lot of the training data, and I'm sure there's a lot of conversations here about some of the weaknesses in artificial intelligence. But imagine someone who's on public benefits, and they may come from a community that's traditionally marginalized, and they're trying to get that job, and they're struck out. And as I said, I'm on the board of Girl Scouts. One of the best ways to end intergenerational poverty in the United States is getting a 7th grade girl into algebra. If you can get her into algebra and successfully through it, she will get on the pathway to math and science and technology and all of the career fields that we know are possible. So let's say we go ahead and we do all of that, and she gets through, and she's facing this new world that's been disrupted by technology in all of these areas that I talked about. And she gets the first rung of a technology job, and she goes and applies. And machine learning tools are the first layer of screening. And you know what? It's trained off of data that's historically based off of men. So she gets screened out. But let's say she gets that job, and then she's in the workplace and she's doing her job and she's in meetings and going through everything. And again, for performance management, a lot of these tools are being used to observe conversations like this and assessing people's body language and did you participate, et cetera. And again, the bias comes in, and she's marked down and potentially removed. And so what does all this have to do with healthcare? Well, as the issue that was raised earlier, the very important question of do people in healthcare have to solve all of these problems? And I will say no. But we do need your voice, and we need your muscle, because healthcare folks are innovators. In most communities, you're the largest employer. And so as your colleagues here and elsewhere, as you sort of go out into industry and doing what you do, are working on transportation and retail and HR tech and all of these things, think about how if they got it wrong, how it could affect the health and wellness issues that you're dealing with. And nudge them and force the conversations and push them along. So not long ago, we had a gentleman who we worked with who called into our call center, and he gave us a little feedback. And we were able to, he had type 2 diabetes, and we were able to get him SNAP, food stamps. And he told us, look, I'm trying to take care of myself. My diet is not consistent with a normal person's diet, and it's difficult all around. But these food stamps will help me get back on my feet with my health plan, and if I follow the rules, and I can follow what I know to eat and what I shouldn't eat. Now, this is good. This is what Benefits Data Trust is there for, to make that concrete step and improvement in that man's life. And he was able to use those benefits to get food and then use that as a bridge to get Social Security disability benefits, and he's a little bit more economically stable. But frankly, that's not good enough. We should have been able to screen him for benefits when he was being discharged from the ER. We should have been able to, frankly, use a lot of the data and other analytics that we have to figure out, wait a minute, before, frankly, he ended up with type 2 diabetes, to say, hey, wait a minute, there are some health issues. And so when his healthcare provider, if he had access to one, was having those conversations, we should have then been able to figure out, well, you know what, he has some economic challenges in his life, probably lives in an area in a food desert. And so let's at least make sure he can get some of the benefits and do some of the other interventions that could have possibly staved off type 2, or at least make sure that he can stick with a decent treatment regime. And for this type of gentleman, imagine this multiplied hundreds of thousands of times all across the country. If we can do what's right by him with these benefits, and then make sure that he's in the type of community and has access to the type of opportunities, and that all the innovations that frankly are invented by folks here at this school are actually applied to his life and has equity and opportunity engaged in that, that is how we scale ending poverty in America. That is how we scale health and wellness and do all the things that we're supposed to do. And so thank you for having me here, and this has been a great, great conference.
Thank you, everyone, for spending the day with us. Thank you, Trooper, for those fabulous ending remarks. We really, really, really appreciate you spending your Sunday with the 17th Annual Healthcare Conference here at Harvard Business School. I would like to extend a heartfelt thanks to the team of HBS students, particularly Jay Thacker and Perry Smith, who without this, we would not have put this conference on. Our volunteers and also our sponsors. Our sponsors are DaVita, Hackensack Meridian Health, Humana, Optum United Healthcare, Oak Street Health, Salton City, Edwards, Rubicon MD, Health Advances, Harvard Business School's Healthcare Initiative, and American Well. So thanks to them as well. So with that, I will ask the HBS team as well as our sponsors to come on down to the stage for a quick photo. And everyone is invited to a networking reception across in Spangler on the first floor Williams room. Thanks for a great day, guys.